Hi and welcome to another video. Today I'll discuss multiple myeloma. For some key background information, it is a cancer of the blood and it is a type of cancer that affects plasma cells, which are a type of white cell that produces antibodies to fight infection. It is characterized by the overproduction of abnormal plasma cells in the bone marrow and the lymph tissue, which results in all of those cells producing the same monoclonal antibody. The overproduction can cause crowding and may push out the healthy blood cells, preventing them from being produced at a healthy and sustainable rate, which can also lead to organ issues and issues with the bones due to the secondary effects that the cancer might have. There are roughly 6,000 new cases a year in the UK, and the median age at presentation is 70, so age and family history are the strongest risk factors to be aware of. Now for some pathophysiology. Firstly, I'll go over the systemic disease. So there is a mutation. It could either be a translocation or a gene or chromosome deletion, but the mutation causes plasma cells to produce antibodies unregulated, meaning that it does not stop, and the systems that were typically in place to prevent overproduction of a particular antibody are no longer present. This results in the production of the same antibody at a very high level, and because of this unregulated replication division of these plasma cells, there is bone marrow crowding, which causes other antibody levels to drop because other plasma cells are unable to replicate sustainably in this environment. In terms of the bone disease, you have adhesion molecules which can travel from the affected plasma cells to the bone marrow stromal cells, and there those bone marrow stromal cells get stimulated to release cytokines such as tumor necrosis factor. Those cytokines in turn then cause osteoclast genesis and increase osteoclast activity. Osteoclasts, they eat up whatever calcium stores are present, and also there is an impaired osteoblast formation, meaning the osteoblasts, so the builders of the bones, are unable to repair whatever damage is being done, which causes the well-known lytic lesions of myeloma. In terms of the clinical presentation, I would like to focus on 4 areas. Firstly, the kidneys. You can get issues such as amyloidosis and nephrocalcinosis and reduced urine output. In terms of blood problems, you could get things like fatigue, anemia, pallor, and bleeding. And again, all of this is due to the bone marrow crowding. Other cells are unable to reproduce, which can cause bleeding and easy bruising. In terms of infection, there is an increased infection risk due to the immune dysfunction. So the patient may present with more frequent infections, or they may present with infection with an atypical pathogen, one that you would typically see in someone that might be perhaps immunocompromised. And again, this is because you do not have enough of the other antibodies being produced due to the overcrowding. And lastly, you can get pathological fractures and bone pain. In terms of investigations, a lot of investigations would be undertaken. However, one of the key ones are bloods and blood film. So you would see anemia, and the blood film would show something called a rouleau formation, which is almost like a stack of coin presentation of red blood cells. And you also see high calcium, again due to those lesions in the bone. Next, you want to check the creatinine and urea. So in terms of the levels you'd be concerned by, it would be creatinine over 176 millimoles per liter, or a creatinine clearance of less than 40 milliliters per minute. You would also want to do a bone marrow biopsy, and that would show monoclonal plasma cell infiltrate, or something called a plasmacytoma, which is essentially a lump of plasma cells within the bone marrow. Lastly, you should perform some imaging, especially an X-ray and a whole body scan. And you would see things such as punched out lesions, lytic lesions, pathological fractures, or the pathognomonic for multiple myeloma is the so-called raindrop score. In terms of the management, first line is of course chemotherapy, but the VT prophylaxis is also important due to the increased risk of clotting. And lastly, you would also want to provide some supportive care for the patient. That was a very brief overview of multiple myeloma. If you have any questions, feel free to leave them down in the comments. I hope this was a good brief summary, but if you have any questions, feel free to leave them down in the comments. Thank you so much for watching, and I hope you consider subscribing.